The professional care of feet dates back to ancient Egypt. This is about 2400 BC. Hippocrates first described corns and calluses and the need to physically take care of hard skin and its causes. Since then, a lot has changed, and now we have the field of podiatric medicine that takes care of feet and ankles. In Kenya, we have a foot and ankle surgeon who will be taking us through this discussion on what you need to do in order to take extra care of your feet. But first of all, how often do you check your feet?
Every day.
How do you check?
I look with my eyes. I look at them. And especially as I wash, take a bath.
You know, there's looking and there's examining. Examining is where you check there is a pimple, there's a dead skin, there's a lump, maybe it's swollen. You just check it. There's a, if you have kama kuna fungo, but checking you can just check whether they are clean and that's enough. So there's a difference. There's a time I was doing it, but it's kind of now I forgot. I was removing his dead skin and then the daughters took over, and then it's like it disappeared when they grew up. And for me, when I became busy, I think I forgot. Yeah. So unless he does it alone in the bathroom, but for me, I can't even remember the last time I did it for him. As a lady, like two times in a week, you concentrate on checking on your nails, the dead skin. The dead skin, you just you scrub a bit and see if there's something coming out.
Ai, daily. Kila siku.
Unaangalia nini ukiangalia miguu?
Nikitoa socks.
So what do you check?
Sinaangalia kucha alafu nijue kama miguu yangu, kama nikitoa socks nijue kwanza kama zinanuka. Ndio mahali nimeshinda.
When I'm bathing.
How do you check them?
Si unainua tu mguu.
Nakata kucha. Najisugua hivyo tu. Hakuna kitu kingine.
My feet, I regularly check it.
How do you check them?
When I'm washing them, and maybe when I get injured, something like that.
Yeah, I keep them clean all the time.
How do you check them?
I wash them every evening and every morning. Yes.
You do it yourself?
Yes, I do it myself.
Do you do pedicures?
No, I don't.
Why?
I don't. It's not necessary for me to do that. Yeah, pedicures are for women.
How often do you check your feet?
Daily in the morning.
How do you check them?
By washing them.
Can you show us what you do?
What I do when I'm in the bathroom, I scrub them.
While people do not take keen interest in their feet daily as they do other parts of the body, a minor problem with your feet may turn out to be so serious that surgery is the only way out. At Kikuyu Hospital's Orthopedic and Rehabilitation Unit, Ikline Nyangweso was just about to get corrective foot surgery, as narrated by Mary Mwoki.
When 48-year-old Ekline's foot started swelling, she didn't know that it might get to such a situation. She went from hospital to hospital searching for treatment. Doctors ran numerous tests, but none could satisfactorily establish the cause of her swelling. It was a period of deep anxiety for her and her family. Ekline, who has been living with diabetes for 3 years now, was not aware that her diabetes predisposed her to a condition known as Shaco foot. When a patient has this condition, the bones in the foot are at risk, and with continued walking, the foot eventually changes shape and gets deformed. She finally sought treatment at Kikuyu Hospital, where Dr. Ezekiel Oburu planned a surgery to correct her foot from this deformity to this, which will take her 3 to 4 months to heal. Although she is still recovering from the corrective procedure, she looks forward to resuming her life as she knew it before her foot deformity. A constant and thorough examination of your feet may save your limb from amputation. Eckline is lucky that she got help in time not to lose her left foot. Mary Mwoki, KTN News.
Prior to the surgery, Dr. Oburu took us through the assessment and preparation for the surgery and what foot and ankle surgery is all about.
I do quite a bit of foot and ankle. Maybe 25% of my practice is foot and ankle surgery, which is my subspecialty. So I correct quite a bit of deformities in the foot.
As we know, diabetes affects many aspects of parts of the body. It affects the kidneys. It also affects the nerves. But one of the things that it does affect is the feet. And what happens is these patients, because they don't have a good sensation of their feet, they tend to get something known as Shaco Arthropathy, where they get deformation of the feet. Sometimes it's not very painful. Sometimes it has a little bit of pain, and this deformity just continues to progress.
Obviously, if you see a patient with a very badly deformed limb, especially after massive trauma, the patient would be in severe pain. You know, the patient would hardly be able to walk. But these patients, they have some form of function, and they're walking on this very deformed foot.
First, number one, we do not know 100% how that does happen. However, one of the things that happens is it affects the nerves. And when diabetes affects the nerves, these patients, they don't have very good sensation on their feet. Now, for any normal human being, when they are walking or when they get hurt, they will realize they're getting hurt, they realize something's happening to their foot, and they'll tend to move. But these patients, they don't have that same sensation. And therefore, even when their foot is developing a problem, they don't react to it, they don't do anything to avoid this. That is what is postulated. This does not only affect diabetes, it affects other conditions that affect the nerves. However, the main cause really is diabetes because it affects the foot. The other conditions are not common. Some of them are conditions that may affect the spinal cord. Like one of the conditions is known as syringomyelia. One common condition that used to affect it in the past was syphilis. However, that does not affect it as much because this is properly treated. Some patients also that I have treated have presented with a Shaco foot without any prior history or any condition. If we look at her foot, this is her normal foot, and you can see her foot is quite a good, normal, supple foot. The ankle goes up and down all the way. And then we have a joint, it's called the subtalar joint, that enables you to walk on uneven surfaces, and that goes all the way. However, if we look at her abnormal foot, we can see, and we'll probably see this when she's standing. Maybe I can get her to stand. So we can see that as she walks, she's walking completely on the outer border of her foot. Yeah, she's walking and she's finding it very difficult to walk. And what I'll do is I'll get her to turn around. And you can also see that if you look her alignment of her foot, I'll just get her to lift her dress a bit. Unaweza kuinua tu kidogo. Kidogo hivi. Kidogo tu. If we look at alafu kanyanga chini. So if we look at the alignment of her foot, we can see that on this side, the foot has normal alignment, but on this side, the foot is completely curved. There is what is known as a marked varus deformity. Unaweza kuangalia hivi? So there is what is known as a marked varus deformity if you compare the right side as compared to the left side. Unaweza kuketi. So I'll get her to sit because it's a bit uncomfortable for her. So the plan really for her is to do an operation that will at least enable her to be able to step on the foot. Now, the operation will entail making a small cut on this side. If you look closely, you can see that the skin is already threatened on that side, so obviously the operation is urgent. We'll make a cut on this side. We will remove some bone, and then we will straighten the foot. Now, the other problem with this condition is that the bones are not very good sometimes, and therefore many a times when we do operations, what we try to do is we try to fix the bone in position with implants that are internal. But in this case, because the bones are not very good, we will try and use both implants that are internal, and we'll use an implant that is external. We call it an external fixator or a ring fixator. So we did some x-rays, and I will show you the x-rays over here. If you look at this x-ray, you can see that that bone is called the tibia. Okay, so the x-ray is in two views. That's one view, and this is another view. So this bone is called the tibia, and this bone here is called the talus, and that's part of the talus. And the talus, and this is called the calcaneus, or the heel bone. So that bone is crumbled up completely. All right, that bone is crumbled up, and maybe the blood supply is also not as great, but we'll see when we go in. Now, what happens in this condition is that you get crumbling up of this bone, or sometimes even bones around here. And what we are going to do, and you can see the foot is twisted that way. So my plan is to try and get that bone, you know, to get that, to remove this, the cartilage of the bone, all right, of both bones, and maybe to remove the cartilage of that too. Then after that, to bring the foot this way. Sometimes you have to get rid of the whole of this bone and fuse that bone to that bone. You do what is known as a tibio-calcaneal fusion. Not all of them are operated. Sometimes we just manage this non-operatively, especially patients with Shaco joints that are the midfoot. There's a criteria for operating. In her case, this has been going on for quite a bit of time. The deformity is now at a place where it's not consistent with what she can weight bear, and therefore she will need surgical correction. There is what is known as acute Shaco, and this is what is known as something that's chronic or something that's established. In the acute phase, sometimes you may have swelling of the foot, deformity of the foot, and when you examine them, sometimes you're not sure whether it's an infection or it's not an infection. One of the things which are called feet is that when you lift it up, the swelling tends to go down. That is what you may get in the acute. In the chronic, they usually present with deformities. It may be that the foot, the normal alignment is not there, and they may have what is known as a rocker bottom foot or a flat foot. And the other thing is that sometimes the deformity is much worse. When you examine them clinically, the patient is not in as much pain. Obviously, their neurology many a times is compromised, especially if they're diabetic. The problem is the nerve supply. You know, your joints have what is known as pain fibers, what is known as proprioception sensors, and pain sensors. So when you get an injury, you know, you do get, you know, the foot tells the brain that, hey, it's painful here, and the brain. But these patients, because of impaired sensation, they don't have that, and they've got no sense even where their foot is, and so the foot may get destroyed. But we don't completely understand Shaco feet. Sometimes you can get one foot and that foot gets better, and then you get the other foot.
It's not that it's spread, it's just two independent disease processes. One of the worst complications is an amputation. So because of the abnormal position of the foot, you find that the patient may be walking on a prominent bone surface, or bony prominence. And when they walk on a bony prominence, you may get ulceration. When they get ulceration, they get a breakdown. When they get breakdown, they may get infection. And ultimately what happens is they may get infection, and that may lead to amputation of the foot. The other thing is also a loss of independence. These patients have got many needs. They're diabetics. They need to be able to get around. Sometimes when you can't walk, you can't get around. And the other thing is pain. Much as I say that some of them don't have much pain, some do have pain. And when your foot is very abnormal, it can be quite painful because you're putting a force or weight on areas you shouldn't be. One of the things that will happen is that it will take some time for it to heal. I estimate it will take about 3 to 4 months at least for the foot to be able to heal. What you're trying to do is to get the bones of the joints to fuse, and obviously these are bones which you don't want to fuse because there's a joint, but you're trying to get the bones to fuse. Now, after it takes about 3 to 4 months, then she should be able to start walking. Yes. Although we will give her a boot because she's diabetic, they sometimes take much longer to heal. So we may give her a boot, but eventually the plan is for her to be able to walk. One of the do's and don'ts when you do a fusion is to tell them not to weight bear, okay, so that you can allow the bone to heal. Some patients are compliant, some patients are not. Obviously, when a patient has got a frame or a ring fixator, that allows an element of play, but you still want them not to weight bear until it heals. So you'll tell them to use crutches for a while. For the initial fusion period, after a while, they can start putting weight on it. Okay. The most important thing is the wound care. These are pins that are sticking out of the body, so sometimes you have maybe a chance of getting a pin tract infection, so you want to avoid that. So what we'll do is we'll ensure that the wound is taken quite well care of. Yes, until we are able, at such a time that we are able to remove the pins. I think the most important thing for diabetics really is sugar control. That is the most important thing. So, a diabetic foot develops after a while in patients with diabetes because of sometimes it's poor sugar control. So it behoves every patient of diabetes to take that very seriously. The other thing is also they should always examine their feet, make sure that they don't have any sores, because this is not the only problem that diabetics have. They tend to have other problems in the feet, like infection and problems with poor circulation. So they should ensure that they're always doing a thorough examination of their feet. And when they develop a deformity, it's important for them to be able to see a doctor so that that deformity can be sorted in good time.